welcome to my presentation for Biology 2A on common reproductive health concerns for women. This is Brooke Williams. I specifically want to talk about 5 different health concerns: 1, endometriosis; 2, uterine fibroids; 3, gynecological cancer; 4, interstitial cystitis; and 5, the polycystic ovarian syndrome, or also known as PCOS. First, let's go ahead and talk a little bit about the female reproductive anatomy and some of the functions of those different parts. So we have the fallopian tubes, which are small tubes that connect the ovaries to the uterus, which is a hollow muscular organ in the female pelvic area, and this is responsible for providing the nutrients in a developing fetus during those 40 gestational weeks. Ovaries are responsible for producing egg cells. It's also where the reproductive hormones are produced. And the cervix is the area that allows for menstrual blood to be released from the uterus into the vagina. It also provides a canal for sperm to move directly into the uterus during intercourse. Some of the other areas with the endometrium, which is the mucous membrane lining of the uterus; the myometrium, which is the muscular outer layer; the internal os, the opening to the uterus; and the external os, which is the opening to the cervix. All right, let's talk a little bit about the endometriosis. Endometriosis does involve the ovaries, fallopian tubes, the surface of the uterus, the bowel, and the membrane lining of the pelvic area, also known as the peritoneum. It is less commonly found in the vagina, the cervix, or the bladder, and very rarely do we find it spread outside of the pelvic organs. This endometrial tissue can cause severe pain and infertility and very heavy periods in women. There are 4 stages of endometriosis. The different stages are based upon the location, the extent, the depth of the endometriosis implant, as well as the presence and severity of the scar tissue. There's stage 1, which is minimal; stage 2, which is mild; stage 3, which is moderate; and stage 4, which is severe. And you'll notice in the photos the look of the different uteruses there and how severe the extra adhesions are. But specifically in stage 4, you'll notice quite a few adhesions there, and that's definitely where a lot of that pain is coming from. All right, let's talk a little bit about the common symptoms for endometriosis. There's cramping during intercourse, very painful bowel movements or urination, infertility, lower back pain and abdominal pain, and of course the other symptoms that we talked about, like irregular or heavy menstruation. Some of the treatments that can be given for endometriosis will be pain medication to help with that pain or that severe pain with the more stage 3 and 4 endometriosis. Hormonal therapies, things that can, different pills, different birth control pills or progesterone pills that can be given to help with some of the symptoms and helping to regulate some of those hormones to help with the endometriosis. And then surgical treatments that can remove some of those adhesions in and around the uterus area, or also in more severe situations, even remove that uterus in a full hysterectomy. All right, next go ahead and talk about uterine fibroids. Fibroids are the most common non-cancerous tumor. They are found inside and some sites on the outside of the uterus. They are made of muscular cells and other tissues. And some of the risk factors can be being overweight. Fibroids do come in different sizes. They can be as small as a pea, and some can be even as large as a melon. Symptoms and treatments for uterine fibroids. Some of the symptoms can be very heavy and painful menstruation, fullness, or a hard lump in the lower abdomen, excessive urination because of that lump or that tumor pushing down on the bladder, pain during sexual intercourse, lower back pain, or reproductive problems such as infertility, multiple miscarriages, or even early labor. Some of the treatments for uterine fibroids would be iron supplements, especially for women that lose a lot of blood during the menstruation, anti-inflammatory or anti-hormonal medications that can help to balance out and hopefully prevent more uterine fibroids or the fibroids from growing larger. And of course, there's also a surgery option, like embolizing the uterine fibroid so that no more blood comes to that area, a myomectomy, which can remove that fibroid in some cases from the uterus, or a hysterectomy in severe cases where the whole uterus is removed. There are 4 types of uterine fibroids: the intramyomedial, which grows inside the muscle layer of the uterus and are the most common; the submucosal, which go on the inner lining of the uterus and into the uterine cavity; and the subserosis, which grow on the outer cavity, the outer surface of the uterus into the pelvic cavity. There's also the pediculated, which grow on the outer surface of the uterus and are attached by a small narrow stalk. Those are less common, but also happen occasionally. All right, let's go ahead and talk a little bit about gynecological cancer. Gynecological cancer is best defined as any cancer that starts in the woman's reproductive area, usually between the stomach and the hip bones. There are 5 main gynecological cancers, one being the cervical cancer, which begins in the cervix; ovarian cancer, which begins in the ovaries, and those are located on each side of the uterus; uterine cancer, which begins inside the uterus; vaginal cancer, which begins inside the vagina; and vulvar cancer, which begins in the vulva area. Gynecological cancer symptoms and treatments. A few symptoms to help recognize the need for possible testing for gynecological cancer would be unusual bleeding or discharge, feeling of being full too quickly, bloating, or even abdominal and lower back pain. There are quite a few different treatments based on the type of cancer that is identified, but I'd like to kind of focus on the surgical procedures that can be taken to help in this situation. So one would be the debulking surgery, which is removal of all or most of the tumor; a total hysterectomy, which would remove the uterus and the cervix; a radical hysterectomy, which would remove the uterus, the cervix, part of the vagina, possibly even the ovaries, fallopian tubes, and the lymph nodes in that area; a unilateral salpingectomy, which removes 1 ovary and 1 fallopian tube; and a bilateral salpingectomy, which removes both ovaries and both fallopian tubes. An omentumectomy removes the omentum, and the lymph node removal would remove some or all of the lymph nodes in that general area. All right, interstitial cystitis or bladder ulcers, also a chronic condition causing a bladder pressure, bladder pain, and sometimes even pelvic pain. The pain can range from mild discomfort to just a very severe pain. The condition can cause different flare-ups that can be caused by triggers such as menstruation, sitting for a long time, stress, exercise, or even sexual activity. The causes of bladder ulcers are unknown. There is some data collected that suggests that people with a defect in the protective lining or the epithelium of the bladder can cause these bladder ulcers. Some of the signs and symptoms of interstitial cystitis or bladder ulcers would be pain in that pelvic area. Frequent urination is the most common one, or the most common telltale sign of interstitial cystitis. Oftentimes, in this situation, there's urination, a small amount of urination throughout the day and night, up to sometimes 60 times. And this is definitely interrupting to that person's quality of life. Pain and discomfort in that bladder that when it fills, and then relief when after urinating, and some pain during sexual intercourse. Some of the treatments that were discussed would be physical therapy, where the guidance is to tighten up the pelvic floor; bladder distension, when the bladder is extended, usually by filling it with water, and then removing that water, and in some cases the distension of the bladder helps to alleviate some of those issues. There's medication that can be instilled into the bladder, surgeries, and oral medications that can be given to help with some of the symptoms and then relieving that ulcer. All right, and then lastly, let's talk a little bit about polycystic ovarian syndrome. Polycystic ovarian syndrome, also known as PCOS, is a hormonal disorder. Women with PCOS often have infrequent or prolonged menstrual periods and excessive male hormone levels. The ovaries may develop numerous small follicles and fail to regularly release eggs. And you can kind of see in the photo there that there's a normal ovary and then a polycystic ovary, and just the difference in the look there. Some of the symptoms of polycystic ovarian syndrome, or PCOS, will be infertility, pelvic pain, excessive hair growth on the face, chest, stomach, thumbs, or toes, baldness or thinning in hair, acne, oily skin or dandruff, and then patches of a thickening dark brown skin. There really is no many treatments for PCOS. Oftentimes, doctors are just helping to control the different symptoms. Diet, exercise are often recommended. Birth control pills are sometimes given to women to help regulate periods and reduce the male hormone levels. Acne medication to help clear up the acne, and then treatments for infertility caused by the PCOS. Some of those treatments include medication, surgery, even IVF. And then last slide is just going over some of the resources that I used for my presentation. I did use quite a few different medical websites to help me gather this information. Thank you for listening.